My name is Shatina. After Mrs. S 3 weeks checkup, she was diagnosed with carpal tunnel syndrome. Based on her test results, she was then a good candidate for surgery. The assessments that went behind this decision were the fact that she received minimal relief from injections. Also, her electromyograph results showed consistent with carpal tunnel nerve compression, and her nerve conduction studies had abnormal results. It demonstrated a slowing of electrical impulses through the carpal tunnel. In terms of nursing interventions, Mrs. S should be educated on the carpal tunnel syndrome, what it is, risk factors, and things of that nature. And also, she should be educated on the surgical treatment. Some things to know is why she actually had to go through with surgery in the first place. And that was because the conservative measures were unsuccessful. That's important to share with the patient so that they don't feel like she's just being pushed out for surgery, as that can be a very overwhelming process, especially if this is her first surgery. Another important thing to note here is that based on clinical guidelines from the Washington Workers' Compensation, workers who underwent surgery based on an accurate and timely diagnosis were able to return to work a lot sooner than the workers that had been diagnosed several months later. Surgery should be performed 4 to 6 weeks from the actual diagnosis and determination of carpal tunnel syndrome. And the fact that the conservative measures aren't helping subside the symptoms. Another thing to note in terms of nursing intervention is the importance to comply with referrals such as the occupational therapy and the ergodynamics department. This department can help do a worker's assessment and see what things maybe affecting or impacting or worsening her syndrome. This should be done in the early stage of diagnosis, but also after she returns to work. The ergodynamics personnel can sit beside you and evaluate if you're turning too much, if you don't have good hand positioning at the keyboard, which would be in Mrs. S case, being that she was a medical assistant providing a lot of data entry and in a clerical support role. Also, the ergodynamics department can review her case and see if that case can be applied to other workers. So in the future, it could help other employees by observing her in her job function. It could be helpful in the future to other employees. So for the first question, why do you think it is important for surgery to be scheduled within 4 to 6 weeks of determination of need for surgery? First choice A, the employee is able to request and extend leave of absence if surgery is scheduled after the time frame. B, it provides the company with huge cost savings. C, federal regulations mandate that the surgery is scheduled within this time frame. And D, research shows that employees who are accurately and timely diagnosed and treated are more likely to return than those who experience delays in both. The correct answer is D. Research shows that employees who are accurately and timely diagnosed and treated are more likely to return to work than those who experience delays in both. Question number 2. Why do you think it's important for the ergodynamics department to review the case? The ergonomics department can identify potential hazards to other employees. That's the first option A. Option B, the company is mandated by federal regulations. Option C, it promotes trust between the ergonomics department and employees. D, allows the ergonomics department to make referrals to physical therapists. Correct answer is A. The ergonomics department can identify potential hazards to other employees. In conclusion, defining the role of occupational health, it looks at the risks associated with any chemical or physical workplace hazards and reviews ways on how to make that environment safer for the workers and also the workers' families. In terms of the carpal tunnel syndrome for our case study, it was important to know that Mrs. S had been working in a clerical support position for over 20 years. The repetitive movement of typing along with force was one of the not just signs and symptoms, but was one of the reasons that attributed to the actual development of the carpal tunnel syndrome. Clinical guidelines show that it's best at following the initial diagnosis to use conservative measures. But then if those don't work, which is the case for Mrs. S, surgery is definitely indicated. This is important because the Washington Workers' Compensation Group, which defines the clinical guidelines, noticed that when workers were accurately and timely diagnosed and treated, their return to work was a lot sooner than workers who had been diagnosed and treated months later. So in turn, Mrs. S was able to return to work within 3 weeks, and clinical guidelines states that the desired amount is from 4 to 6 weeks, which is good because Mrs. S is still within the working age and she's been working for over 20 years. These are our group contributions and our references. Thank you for watching.